Good afternoon, everyone. I am Jen Smith, Secretary for Pennsylvania's Department of Drug and Alcohol Programs, and I would like to thank Dr. Charles Barbera and the folks here at Reading Hospital for having us today to highlight the importance of warm handoffs for overdose survivors. Experiencing an overdose is traumatic. Individuals often wake up feeling an array of emotions, from shame to fear or even embarrassment. These factors, combined with the factors that led to the initial overdose, including opioid dependence, polysubstance use, and/or mental health disorders, leave these individuals feeling incredibly vulnerable. That is why, in the period right after an overdose survivor leaves the emergency department, there is often a high risk of a repeat overdose and of that next overdose being fatal. This is where the warm handoff comes into play. The goal of a warm handoff is to reduce that risk by providing a door-to-door referral, directly transferring an overdose survivor from the hospital emergency department to a substance use disorder treatment provider or other resources. Providing appropriate resources and showing compassion at such a critical time can make all the difference in saving lives and leading individuals to the path of recovery. As I'm sure you're all aware, the COVID pandemic has offset some of the progress that we've made in battling the overdose epidemic across Pennsylvania. Preliminary data from the CDC shows that 5,217 overdose deaths were reported in Pennsylvania during 2020. That's an increase of more than 16% in just 1 year. We cannot and will not accept this. Now is the time to recommit to doing everything in our power to ensure that all Pennsylvanians have access to necessary life-saving resources. As a department, we have reestablished our commitment through our 4 main areas of focus. First is reducing the stigma associated with substance use disorder. Our Life Unites Us campaign is dedicated solely to ending the stigma associated with substance use disorder by sharing stories and lived experiences from people of all walks of life. By sharing those personal experiences and speaking openly about them, we may give someone else the courage to reach out for the help they need and deserve. Next is intensifying primary prevention resources to keep our children, families, and communities safe. The Drug Take-Back program has more than 880 prescription drug take-back locations spanning across all 67 counties of the state. By regularly cleaning out your medicine cabinet, you are decreasing the chances that medications will be misused. Along with this, we're in the process of expanding a workforce substance use prevention program called Just 5. This program will be available to all employers across the state, serving as an important tool to increase awareness, reduce stigma, and share information about substance use prevention and treatment. Our third area of focus is strengthening the drug and alcohol treatment system. Warm handoff programs, like the one here at Reading Hospital, show how we can strengthen the treatment system by streamlining treatment and support services so individuals don't fall through the cracks. Since 2017, warm handoff programs have been implemented in 160 Pennsylvania hospitals. That's 95% of the total hospitals in the Commonwealth. Through these programs, more than 16,000 individuals have been directly referred to treatment. In addition, we're in the process of implementing the Addiction Treatment Locator, Assessment, and Standards platform, also known as ATLAS. Not only will this tool be valuable for the general public to access information on drug and alcohol treatment facilities, but will also help ensure that treatment providers are providing high-quality services. And last but certainly not least, empowering sustained recovery through our Recovery Rising initiative. The goal of this initiative is transformation across systems and communities to create an environment in Pennsylvania where individuals in recovery are empowered not only to stay in recovery, but to thrive. These initiatives and many more all align with our overall goal of improving the lives of those impacted by substance use disorder and ultimately helping Pennsylvanians achieve a life that is substance-free. But we cannot do any of this without the partners that you see here today. Hospital systems like the one here at Reading Hospital play a critical role in saving lives and providing individuals a second chance at life. And county drug and alcohol offices, like Berk's Council on Chemical Abuse, they serve as our boots on the ground, providing life-saving resources, funding, case management services, and assistance to local residents in need. At this time, I would like to turn the podium over to my friend, Dr. Charles Barbera, to provide some insight into the warm handoff program here in Reading Hospital. Dr. Barbera.
Hello, and thank you for coming. My name is Dr. Chuck Barbera, and I'm an emergency physician here at Reading Hospital. We are really fortunate here at Reading because we have developed a program and continually defined a program that is patient-centric, that meets many of the needs, although not all, of our patients with substance abuse disorder. And how did it start? Well, it actually started when we realized that we would have an overdose patient come into the emergency department, and our goal was to get them out of the ED as fast as possible. And we did this, and most patients that we saw were very amenable to being discharged immediately. And Dr. Lehman is here, who is the chair of emergency services here at Reading Hospital, and Dr. Nutting, who's the chief medical officer. We've kind of got together and thought, well, how is this patient focused? Length of stay is one thing, having a bed, of course, we understand that, but how do we help the patient? And more we're having patients come back, and we realize, much like the patient we would see with congestive heart failure or the patient we would see with emphysema, people were coming back. What with the medical diseases, we were doing what we could to prevent a readmission, changing their medications, getting them plugged into a cardiologist, getting them a lung doctor. But for the overdoses, we didn't do that. And why? So we kind of thought, well, why aren't we doing this? And then we realized we had a stigma ourselves. We were not treating substance abuse disorder as a disease. We were treating it as something different. And once we put substance abuse disorder in our EMR like every other disease and developed protocols and pathways around the treatment of this disease, much like we do for a heart attack and a stroke and everything else, we began to see some traction. And we partnered with the Department of Drug and Alcohol and with the Council on Chemical Abuse and TASC and others, CCBH and other people, to say, well, how are we going to meet this population? Because this isn't just a Reading Hospital solved problem. This is a community issue. It's a public health emergency. And so once we did that, we were able to see patients and say, how would we best meet their needs? How would we treat this patient if they were our relative? How would we treat them if they were our neighbor, if they were our child? And then we began to develop these processes, and we realized that it was key. One of the pieces that we were missing was we had great nursing staff and excellent physician staff, but we didn't have that relationship with the patient. And that's where TASC and COCA came in, with the certified recovery specialist. And Kathy, will you speak to that role? Okay, so I won't go through what that is. There's a certain training and history that these patients have, but they have a unique ability to relate to patients. And what we saw when we started having this program, was we were able to get up to a third, in some months even more, of our overdose patients into treatment immediately from the emergency room. And we found when we didn't do that and we asked people to follow up and call this phone number that they didn't do it. Almost 0% of the time did they follow those instructions. So, like the secretary said, our only shot was when they were in the emergency department. And so when you have a heart attack, we don't give you a card and say, call a cardiologist. And that's now, we call a cardiologist and we get you to the cath lab. Now with overdoses, we do the same thing. So I want to tell you, we are going on almost 5 years of the Warm Handoff program. And we've had almost 5,000 patients that have come through this program. I am proud to say about 62% of them we have been able to get immediately into treatment from the Reading Hospital Emergency Department. That's tremendous and tremendous. There is another segment of this population that we've been able to provide outpatient treatment for, and yet and another segment that at this point, and again, it's a constant vigilance with patients. At this point, they are not yet ready for inpatient treatment, and we were able to provide them home Narcan kits to them and their loved ones, so should this happen again, we get another shot at talking to them. And I must say that the people that decline treatment, it's not always because they're not ready. Sometimes the social situation does not allow them to be ready. They have jobs, they have families, they're caregivers, they take care of their parents, their children, they have 2 jobs that they just can't afford to be out of work and go to treatment. And that's where Dr. Lehman and his crew have developed then buprenorphine programs and other things where we can start treatment in the ED and have people go home and continue that treatment, follow up with our Center of Excellence for maintenance of that therapy. So we're excited about that. We know we have a lot of work to do. We're just embarking on our telemedicine approach to substance abuse disorder at Tower Health, where we can expand those services to even more patients that need them. So I thank you all for your attention. And now it's my honor. This program wouldn't be here without Kathy Knoll, and Kathy is the associate administrator at the Council on Chemical Abuse, and a great partner. So Kathy, please. Thank you, Kathy.
Good afternoon. Thank you to the Reading Hospital for allowing the Council on Chemical Abuse to be here today. The Reading Hospital Warm Handoff program is truly a collaborative effort. The program is operated by TASC, which is Treatment Access and Services Center, through a contract with the Council on Chemical Abuse, and with funding support from the Reading Hospital Foundation, Council on Chemical Abuse funds from the Department of Drug and Alcohol Programs and the County of Berks, and funds from Community Care Behavioral Health, which is our managed care partner in the county. The Council on Chemical Abuse is the single county authority in Berks County for drug and alcohol programs. And when we talk to our counterparts across the state, other single county authorities, and we tell them about the Reading Hospital Warm Handoff program, they're amazed. And they say, wow, how you really have recovery support specialists in the emergency department 7 days a week, 24 hours a day? And we say yes. And they say, oh, we want to do that. How can we do that? And we say, well, you're going to have to find yourself a Reading Hospital and a Dr. Barbera. I want to be totally clear. You heard me talk about all our funding partners, but without the willingness of the Reading Hospital and the leadership of Dr. Barbera, this program would have never been started and could never have grown to where it is today. So just to give you a little bit of history, this program was started in December of 2015. And at that time, it was an on-call service where the emergency department personnel would call Treatment Access and Services Center, and a certified recovery support specialist would come to the hospital and meet with the patient in the emergency room, offer support and an immediate referral to treatment. Very soon after the program started, Dr. Barbera and his team at the emergency department realized that there were people coming in not necessarily from an overdose, but they were in opioid withdrawal. So very soon, the program was expanded to include people with opioid withdrawal. By the end of 2016, the program was further expanded to include anyone with a substance use issue coming into the emergency department. So you no longer just had to be opioid. So people with stimulant use disorder or any kind of substance use disorder could be referred to the warm handoff. By May of 2017, it was clear that this program was desperately needed and was making a difference in people's lives. And it was at that time the Reading Hospital invited TASC to have certified recovery specialists embedded in their emergency department 24 hours a day, 7 days a week. At that time, TASC, under the direction of Dan Malloy, worked very hard to prepare his certified recovery specialist staff to provide warm handoffs full-time in the emergency department. The Council on Chemical Abuse, TASC, and all the certified recovery specialists have been committed to this program since day one. Currently, the program is supervised by John Jay from TASC and continues to offer compassion and hope to patients suffering from substance use disorder. I think it's important to point out that it makes a difference for many people that the certified recovery support specialists who are talking to them are people with lived experience. They are people in long-term recovery. They are people who can say to a patient, "I've been where you are. Recovery is possible." We heard Dr. Barbera talked about that warm handoff services have been provided to almost 5,000 people since the beginning of the program. While some of those warm handoffs were initiated by St. Joseph Hospital, the majority, in fact 95%, happened right here at the Reading Hospital. And again, we see the same statistic. About 63% of people are accepting a treatment referral. So while these numbers are truly impressive, I'd just like to share with you how this program impacted one person and their family. It was a couple years back, and I had a chance meeting with a woman and her adult son, and the woman told me that she was looking for drug treatment for her son. She said that he had been up for the past 3 days using drugs, and she didn't know how to help him. And I could tell she was very overwhelmed and very, very worried. So we talked for a minute about, what might some of his options be. And at that point, I turned my attention to her son, and I could tell he had been in some sort of an altercation. He had a black eye and all kinds of cuts and bruises. His eyes were kind of vacant, and he was having trouble answering the questions that I was asking him. So I turned back to the mother and I said, you can bring your son right into the emergency department at the Reading Hospital. And she seemed a little bit frustrated at that, and she said, no, I don't want to do that, because all they'll do is fix his physical injuries, and he needs drug treatment. And I said, okay. So I started to explain to her about the warm handoff program. I told her that the doctors would call in a recovery support specialist and that they would talk with him about treatment and help him get into treatment almost right away. I told her that the doctors at the emergency department and the warm handoff would take care of her son. And you did. The mother called me the next day, and she told me that her son was being transferred to a residential treatment facility that day. She said the doctors held him overnight because he did have some medical issues and they wanted to make sure that he was okay. And the recovery support specialist came in and spent time with him, encouraged him to accept a treatment referral, found him a treatment bed, and she said she was so relieved. She said, this is the first time that I have hope that my son can recover. Wish I could tell you more about what happened with that young man, but the only thing I know is that he was admitted to treatment, and because of this program here at the Reading Hospital, he got a chance to start his recovery journey. So in closing, again, I'd just like to thank all our partners, the Reading Hospital, Department of Drug and Alcohol Programs, Berks County, TASC, and Community Care Behavior Health for joining with COCA to provide the warm handoff program. And I want to thank all the certified recovery support specialists who show up here every day to offer those suffering from substance use disorder the chance to begin their own recovery process. Thank you. I believe now Secretary Smith will offer some closing remarks.
Thank you, Kathy. It's truly amazing work that you just heard about. And you hear the phrase, it takes a village, right? It does take a village, and Reading Hospital and the County of Berks have a really strong village supporting this. We even have some representatives here from our legislative offices in the area. They are also tremendous partners in supporting addressing substance use disorder and this crisis. So it is really important to have all of those pieces supporting this process. It's critical to the success. So as we wrap up today, I would be remiss if I didn't take the opportunity to share some information about our Get Help Now hotline for individuals who are seeking treatment, who might be outside of the reach of Reading Hospital. So this message is for any Pennsylvanian battling a substance use disorder. Please know there are resources available to help you. Pennsylvania's Get Help Now hotline is available 24 hours a day, 7 days a week, all 365 days a year. The number is 1-800-662-HELP or 1-800-662-4357. Whether you are the individual in need of services or maybe a family member inquiring about services on a loved one's behalf, there are trained individuals that can help you navigate those local resources and different treatment options in your area. And that's true regardless of your funding status. So it doesn't matter whether you're insured, underinsured, or uninsured. There is help available. Asking for help is not a sign of weakness. It's a sign of true strength. So thank you for coming today, and at this time I will open it up for any questions that you might have for myself, Dr. Barbera, or Kathy. Yes.
What kind of success have you had feathering this out across the state?
That's a great question. So the question was, what success have we had with the warm handoff program sort of statewide? And the answer is it really does depend on the region. We've seen some tremendous success stories similar to Reading Hospital in other areas. For example, in Armstrong, Indiana, and Clarion counties, which is a much more rural part of the state. We've seen sort of this similar 60 to 75% success rate on average. Other places have struggled a little bit in terms of forming the relationships that are necessary with the hospitals and the providers. And so in some of those, we see lower percentages. The average, the last time I checked statewide, was a 50% success rate. So, that's still 50% of the time we're getting individuals connected to services that they otherwise wouldn't have had access to. So I think that the goal now is to build on some of those programs that are seeing some lower percentage successes, and also still working. I mentioned that we're in about 95% of the hospitals. We still need to work on that last 5%. So still a lot of work to do, but taking many lessons learned from Reading Hospital and from Armstrong, Indiana, Clarion, looking at what technologies are they using, how are they tweaking their processes, and applying that in other places. Thanks for that question. Any others? Okay, thank you very much. That concludes our event.